Hey everyone, today I want to share a really difficult story of one of my patients I met today, and I'm gonna, just for privacy's sake, I'm gonna call him Robert. And Robert's in his early 50s, super hardworking, and like a lot of people nowadays, right? There's a lot of stress, and with the stress and over the years, his alcohol intake has crept up, and you know, he's drinking 3 times a day, all kinds of drinks. Vodka is his favorite, and he's also a smoker. He's cut down to about a pack and a half a day. And he came to me because he was very fatigued, and he went to his regular doctor. Through a series of tests, there seemed to be something abnormal about his pancreas. So he was referred to me to look at his pancreas with something called an endoscopic ultrasound. So an endoscopic ultrasound is a scope, like a little lighted scope with an ultrasound tip, and what you do is you give somebody sedation through the IV so they're sleeping. While they're sleeping, you take the scope and it goes into your mouth, into past your esophagus, your food tube, into the intestine and the stomach. And the pancreas sits millimeters away from that. So you can get a great idea of what the pancreas looks like. And so I performed this endoscopic ultrasound on this gentleman, and I looked around carefully, and unfortunately, I found what looks like a pancreatic mass. It's always one of the worst things for me to see, or give somebody a diagnosis of a pancreatic mass. Now, I don't know if it's cancer yet, but I've seen enough pancreatic cancer that it's horrific. It's a death sentence, and so when I talk about this, I'm not here to scare people. I'm not here to you know make you fearful. But this scenario plays out all throughout the world in hospitals and clinics and endoscopy centers all over the world. And the truth is this, that pancreatic cancer is a devastating disease, can affect really anyone. And we know that some lifestyle choices, especially smoking and excessive alcohol use, can dramatically increase the risk. So we'll talk about this, and I want you to look at this video in its entirety to see what we can do to modify that risk, and really how smoking and alcohol really plays a role in this horrible disease. So let's talk about pancreatic cancer, one of the deadliest cancers that we face today. So we have tragedies with breast cancer, colon cancer, but here's the difference. At least with those types of cancers, you have screening methods, right? Effective early detection methods, so you can catch it early. With pancreatic cancer, thus far, no effective early detection methods, and it's often discovered too late. In most cases, right, people, um, by the time we diagnose, it's too late, and making treatment incredibly challenging. And often people are just coming yellow jaundice, or may not have abdominal pain, may or may not have weight loss. And the fact is this, it's a staggering fact. By the time someone experiences symptoms, pancreatic cancer is already in an advanced stage. And so what that means is that you can't really treat it effectively. And look at this, the 5-year survival rate of pancreatic cancer, 10%. And I can tell you, having dealt with many, many patients with pancreatic cancer throughout my career, this 10% is right on the mark, and it's one of the lowest amongst all major cancer. That's why prevention is so important. If we can stop the cancer really before it starts, we can really save lives, right? Lives like the gentleman. If in fact, it turned out to be pancreatic cancer, we can save lives. And two of the most powerful ways is 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 to stop smoking or not start at all, and to limit alcohol intake. So smoking and alcohol, big problems in this. So smoking, let's start with that. Leading lifestyle risk for pancreatic cancer. Number one, lifestyle risk. And if you're a smoker, your risk of developing pancreatic cancer double, twice as much as those of non-smokers. So it's important to understand that. So why is smoking, right, so dangerous for the pancreas? A lot of us know about the lungs, but what gives, and why is it dangerous for the pancreas? So cigarette smoke contains thousands of chemicals, over 7,000 chemicals, and many of these are known carcinogens. Carcinogens just means that they're cancer causers, right? These chemicals damage the DNA, and then start inflammation and make it easier for the cancer to kind of come in and take hold. Smoking causes what? We know it causes inflammation in the pancreas, which can lead to changes in the cells we call mutations. And then this is kind of a perfect storm for cancer to come in. And we also know this, that people who are smokers, right, have worse outcomes than non-smokers. So so you're not just increasing the risk of getting it, but also makes the disease more aggressive in our research. So something positive and powerful. The moment you quit smoking, the moment, right? Some people may say, well, I've smoked my whole life, it's too late. But the moment you stop smoking, your body begins to heal. The body is powerful in its ability to heal. Within 5 years, your risk of developing cancer goes down significantly. And after 10 years, guess what? Former smokers can have almost the same risk as non-smokers. I'll say it again. After 10 years, former smokers can have almost the same risk as non-smoker. We switch to alcohol. And this is the silent contributor to pancreatic cancer, right? Everywhere in our society, we see alcohol for celebrations, relaxation, social gatherings. It's everywhere. But when you consume alcohol excessively, my patient, he was, drinking several times a day. And so when that's happening, alcohol is far from just harmless and just a social kind of habit. It can be dangerous. And heavy alcohol intake or consumption is a major risk factor for pancreatic cancer. Now, the connection is not as well known as smoking, but the damage alcohol does to the pancreas is really important to understand, and it's really undeniable. So what is alcohol doing to the pancreas to contribute to pancreatic cancer? There's something called chronic pancreatitis. So when you drink heavily over time, it can lead to something called chronic pancreatitis. That's inflammation of the pancreas that's significantly increasing the risk of cancer of the pancreas. And the research shows that in people who have long-term pancreatitis are at 10 times higher risk of developing pancreatic cancer. That's a huge risk, right? And alcohol can increase something called oxidative stress. And so the stress in the pancreatic cells makes them more at risk for cancerous mutations and then increased risk of cancer. And what's worse is that the synergy, right? When they come together, when you get alcohol and smoking together, when they're combined, their cancer-causing effects are not just 1 + 1 = 2, they multiply. So a person who smokes and who drinks heavily is a dramatically increased risk than someone who just does one or the other, right? So my patient, right? When you may ask, what can you do, right? What is there anything you can do? Because you think about if you have a mass, all hope is lost, and it's really a tough. And I'll tell you, as a doctor, it's one of the toughest things you have to do is talk to a patient about something that's potentially life-threatening. It breaks your heart because you know that the reality of it, you've seen it multiple times. But number one, we don't have a biopsy diagnosis of the pancreas, but we're talking about also treatment and survival. And in some occasions we can still, in multiple occasions actually, we can still fight pancreatic cancer with surgery. We can use chemotherapy and sometimes something called radiation therapy. And it's still very difficult, difficult to treat. And it's one of the toughest cancers to beat. So I just don't want you to be in that position. I don't want you to have to make those kinds of decisions, right? I don't want you to be in that position to hear someone like me say, you have a pancreatic mass. So that's why I'm talking to you today, because you have the power to really make the changes that can change your life and protect you for the future. So I know that quitting smoking is not easy, right? It's so difficult. So many of my patients have told me, Doc, it's so difficult. I know that, once alcohol intake has become a part of your life, it's a challenge. But I also know that I've met tons of people who have done both, quit alcohol and smoking. And I'm sure all of you know that you're capable of change. So straight to the point, if you're smoking, quit today. Get support, use resources, do whatever you can to make the first step, right? The first step is the hardest, and protect your health. If you're drinking heavily, try to cut back first and then quit. Your pancreas, not just your pancreas, your liver, your entire body will thank you. Alcohol, when used excessively, is a killer. And listen, if you have a friend or family member, right, who are struggling with these things, please support them and not vilify them, meaning don't blame them and don't, support them, encourage them to really get tools to be able to control these habits. Pancreatic cancer is a disease that is taking too many lives and too quickly, but the good news is that we can prevent many cases by making some really healthy choices. My patient's story, it's a warning, but for those who are listening, watching, it doesn't have to end the same way. You have the power to change your future, to protect your pancreas and your entire health, and to live a longer, healthier life. So my challenge to you is this: take one step, the first step, whether it's putting down the cigarette, skipping that extra drink, or just making a plan to change your habits. Just do that first step today. Because I'll tell you, when it comes to pancreatic cancer, prevention is not just an option. It's really the most powerful chance of a cure that we have today.